Now with a segment on advances in pediatric cardiology, here's our reporter, Laura Windsor.
1 out of 100 babies born will have a congenital heart defect, but many new diagnostic and treatment options are being used to help these children. Pediatric cardiologists like Dr. Aijaz-Hashmi from Desert Regional Medical Center in Palm Springs are often called upon to perform life-saving procedures even before the child is born.
A congenital heart defect means that it is a condition that the child has been born with. Very early on in gestation, when the heart is being formed, usually by about 6 weeks of gestation, even before a mother realizes she's pregnant, the heart has been more or less completely formed, and there has been a defect in the way the heart has been formed. Either there's been a hole in the heart or an abnormal valve, or perhaps some vessels are missing or abnormally connected. So these are all called congenital heart defects. Depending on the severity of the heart defect, usually newborns will present with abnormal coloration of the skin, trouble breathing, abnormal vital signs, trouble maintaining their blood pressures, these type of things. Other children, older children, most of them are completely asymptomatic, but the pediatrician hears an abnormal heart sound or heart murmur that leads to the diagnosis. The technology these days, particularly with the sensitivity of ultrasound, we're able to image the heart structure and function in amazing detail. And oftentimes we're able to pick up many of the heart defects in utero, in the womb, by doing a fetal ultrasound or fetal echocardiogram. So many of these defects can be detected very early on, perhaps as early as 16 or 18 weeks of pregnancy. And in some cases, a heart defect is not diagnosed even until adulthood. Some defects, such as small holes in the heart, may have very subtle findings, just a soft murmur like a flow murmur that may go undetected, or minor valve abnormalities that again have subtle signs, but with age, as the valve function deteriorates, they become more noticeable, and hence the defect is diagnosed in adulthood. If a child is born with a congenital heart defect today, there are more chances than ever that that child will be able to overcome the defect and lead a very normal childhood and grow on into a normal adulthood. So we have a tremendous array of treatment options available these days, and there has been a tremendous revolution, particularly in the last decade or so, in terms of catheter intervention for heart defects. Even very serious and major heart defects can be addressed without a scalpel ever touching the chest. Holes in the heart, even large holes between the upper and lower chambers of the heart, can now be closed using devices that are collapsed and threaded through small tubes or catheters and deployed in the heart. Narrowed blood vessels can be opened using balloons or deployment of stents. And a very exciting area of research over the last few years has been development of valves that can actually be implanted without the traditional open heart surgery. So this pertains to both children and adults that have heart valve problems. Technology has been developed and is now being refined where a heart valve can be implanted, again through the same catheter techniques from the neck or from the groin, with very small incision in the skin, and a whole new valve can be implanted inside the heart without open heart surgery, and that is a very exciting area of development. It's routine general advice that's given to all pregnant women, maintain good nutrition, take their vitamin supplements, and very important to avoid alcohol and drugs, as well as smoking. All these adversely affect the fetal outcomes.
Many kinds of heart defects are minor and will heal themselves, but a pediatric cardiologist is needed to diagnose these problems. For the American Health Journal, I'm Laura Windsor.